Welcome to Pedro Adorno's Expert Insights. In this episode, we welcome three-time hospital CEO, Jon-Paul Croom.
It's not just about eliminating redundant jobs, but I think it's about giving us the opportunity to do more great work in a shorter amount of time. Same with technology. We have to go along with it, or it's going to go along without us. As soon as you're ready, you need to get out, you need to leave the hospital. For these patients who have compromised immune systems, it's a dangerous place. If we could find a way to keep people out of the hospital, we'll win. I hope by the time we get that age, I hope that somebody is passively taking care of me. We are just at the precipice of this. Inpatient revenue, it just doesn't drive a lot of margin. Most hospitals make money in surgeries. I think it is extraordinarily hard to be a physician. We're not only identifying disease states earlier, but potentially finding cures for diseases so that people don't end up in the hospital in the first place. There's not this plan behind the scenes to try to keep people sick.
Today, I'm joined by Jon-Paul Croom, a healthcare executive whose career has spanned over 25 years, leading hospitals for some of our country's largest healthcare systems. Jon-Paul has served as CEO, COO, and market president across organizations including WellStar Health System, Community Health Systems, and Tenet Healthcare. Most recently, he served as market president of WellStar North Fulton Medical Center and senior vice president of WellStar Health System, overseeing one of Georgia's major healthcare markets. He is also a fellow of the American College of Healthcare Executives, which can be considered one of the highest professional distinctions in healthcare leadership. In this conversation, we go beyond the hospital walls. We talk about where healthcare is headed, reshaping of medicine through AI, an explanation as to why hospitals want patients to recover and leave. We discuss the increase in physicians becoming healthcare executives, which leads to the realities of healthcare administration, and why the future of healthcare depends on keeping people healthier, not keeping patients perpetually sick. So if you're interested in healthcare leadership, hospital operations, healthcare innovation, or the business behind medicine, I think you're going to get a lot out of this conversation. Jon-Paul has a lot to offer through his hard work and experiences, but beyond that, he's a wonderful person. So I'm excited for you to listen in to my conversation with Jon-Paul Croom.
What changes are you anticipating coming up?
Yeah, I think what I'm going to say is probably what everybody's, excited about and talking about right now. But I do think that there is a lot of change with artificial intelligence. I don't think it's just our industry. I think it will be multiple industries, and I think it gives us the ability to kind of take that next leap forward in healthcare. It's not just about eliminating redundant jobs, but I think it's about giving us the opportunity to do more great work in a shorter amount of time, to be able to gather information faster, make decisions faster, improve healthcare faster. I think what most excites me about it is the ability to look at a large amount of data as people begin to feel comfortable sharing it and be able to make decisions in real time, and have AI help us as practitioners make decisions for patients, hours or days ahead of when we normally would have gotten those alerts. I think that, and I think that's where we're going. I think we've got the opportunity to provide much higher level of healthcare than ever before. And it reminds me of my dad was an engineer, and years ago in the 60s, he had just come out of early 60s, had just come out of college and had moved down to Florida and was working for this engineering company. And they told all the young guys to go use this new computer, and it was a large room with I can't remember what they're called, scan cards or pieces of paper. They were punch cards.
Yeah.
And so he and one other guy would go in there and do these, do their calculations and do the work they were supposed to be doing. And what normally took them about a week was now taking them a couple of hours. And so for the first year, it was great. They would go in there and get all their work done and basically have the rest of the week off. And finally it caught up because more and more people started using computers and they realized, well, we can just do more work. And so, the amount of work that one person was able to do increased, and there was, still lots of work for everybody. Just the productivity got a lot higher. And I think that's where we are with AI. And, I know this is not just an AI conversation, but I do know that, there are a lot of people that are working hard in various industries to make it valuable for what for their customers, and we're trying to do the same thing in healthcare. And people coming in at different levels. I mean, some people have a high level of understanding. Some people still just use AI as Google.
Right,
What's
right.
what movie is showing on Friday, and where should I take my wife for dinner?
Yeah.
So, but there's so much more. I mean, it's just amazing when you're able to dump data into it. I recently had a client where we were looking at CMS data for placement of rehab hospitals in the state of Florida, and just the ability to take a gigantic amount of data and dump it in there and just start asking questions. And these are all things that you could do if you had somebody that was, good at Excel, or a young intern that, that was very proficient, could put something like this together in a few days. And now you can just put everything in there and start asking AI these questions, and it will give you answers. And you don't need anybody else to do that. It can write the code in the background on Excel.
Right.
Um, and and so that's where I think we are just at the precipice of this, and I think we have a long road ahead of us, but it's exciting.
It's exciting. It's undeniable, whether we want to talk about it or not hear about it anymore. Like,
Yeah.
I agree with you. It's coming no matter what. And healthcare tends to be very cautious. That's a nice way of saying a little bit slow to picking things up and just using them right away, which is because of patient safety and all these other reasons. But I 100% agree with you that it's something that it sounds like you're saying it's very useful and we shouldn't shy away from it. Because I have spoken to other executives and they are like weary of it. Like, the energy that they give is like, right? Where do you feel you stand in terms of positive, negative, cautious, optimistic? It sounds like you're a bit optimistic.
Yeah, I think I'm on the optimistic side. I mean, here's the thing about change: is it's going to happen.
Mm-hmm.
You find, over the years, you find a great group of people to work with. Well, that's going to change. I mean, those
Yeah.
people will get promoted. They're going to move. You can't keep things the same way, and it's the same with technology. It will change, or it will change without you. And we just we're in a situation where we have to go along with it, or it's going to go along without us. It's years ago when I was younger, I used to spend a lot of time kayaking, or they called it paddling, on rivers. And they would always say, when they were teaching you, they would say, look, you can only either go faster or slower than the river. If you go the same speed as the river, it's just going to carry you and run it into, they're going to run you into rocks and into the bank, and it will do all these things to you. It's going to move anyway. So your choice is either try to slow down or try to speed up. And that's where we are with AI. We can either try to slow down, or we can speed up with it. And we don't know, no one knows exactly where we're going to land with this. And healthcare, as you said, we do move slower. We're more careful. We have a lot of, we have HIPAA, where we have to protect our patient information. And there are a lot of, we have to be very thoughtful around that. But at the same time, we have to look at the benefit. And when that benefit, it exceeds the risk, we really have to have those conversations with our customers. Because I really do think this is going to take us to a place where, we're not only identifying disease states earlier, but potentially, finding, cures for diseases, so that people don't end up in the hospital in the first place, which seems very counterintuitive to this business. But I mean, if we could find a way to keep people out of the hospital, we would have, we'll win, and then we'll all be out of jobs. So
That's I love that you touched on that, and I want to actually press on that. Before I do, really quickly though, when I utilize AI, I have in my head, I have categories of like, AI can do that on its own. And then there's AI, I need to check on it before that email is sent, right? Or I'm probably going to edit it. And then there's things that I don't want AI to know or touch about me or my business. And that continues to evolve with new apps and new applications and new comfort levels, new updates. And I see that happening with a lot of the companies that are on the market. Whether I've just spoken with someone named Armand, who has a fantastic business that it pulls in a whole bunch of data, so that when a patient calls in, it's not clueless, whatever business they call into, whether it's an outpatient center or whatever it is. They can be directed to and even have certain decisions or meetings set up with the right physician a lot quicker. Look, all the data's there. It can do things insanely fast, allow it to help. But when it gets to like HIPAA, patient care, we have to slow things down until we really reach that level. But I agree. I hope that we continue to find cures and developments that will help in the acute care space.
Yeah. I think we will. I think we'll look back at today and years from now and just be amazed at where we are. I mean,
Yeah.
you and I just think about like, back in the 90s, if you wanted to check your email, you had to go to a landline somewhere that, or you left your computer at work. You weren't checking it at home,
Yeah.
unless you were plugging in. It wasn't, people didn't text you, and communication happens so fast now. It's amazing how much things have changed. I remember when I started in healthcare, we still had paper records, huge rooms with rolling file cabinets. They were all color coded, and they'd go pull records out, and it was a mess. And it's amazing that we ever survived like that. And I remember having contracts with companies that would, take your old records and store them somewhere off site. And then if I ever needed to pull a record older than 5 years, I'd have to call them and put in a request. And then a couple days later, maybe I'd get that record shipped over. So it was, I mean,
Right.
the fact that we have electronic medical records compared to where we were 20 years ago is just,
Yeah.
I never would have believed it.
The river's flowing and you can't go backwards, right? Like it's almost impossible to do business
can't.
in that way.
That's right.
And what we're experiencing now is it's just has a different name to it, and it's moving at a different speed.
That's right.
Yeah. Yeah.
If you've made it this far, go ahead and click subscribe now so you do not miss the next one. And if you or a friend want help breaking into medical sales, the best place to go is medsalesblueprint.com.
When it comes to, like you were saying, find cures, being able to diagnose better, what do you have to say to the people who really beat up our healthcare system, those who are outside of healthcare, who look at healthcare and they go, oh, they just want to keep us in perpetual sickness? These insurance companies, whoever they point to, I hear that a lot. Do you hear that?
Oh yeah, all the time, especially during, I heard a lot of it during COVID, but, there was a lot of anxiety during that time, and we heard it a lot more then. But sure, yes, you hear that all the time. That there's this structure in place just to try to keep you in the hospital. I can say, at least the companies that I've worked for, that's really not the case. I mean, here's the reality: is that if we can find a way to keep people from coming into the hospital, we can focus on, we can put a tighter focus on more and more acute issues. And I say that you take a person that is, in their 70s or 80s, that's in a nursing home. If you can find a way for them not to come in with pneumonia or some other type of respiratory issue, or develop sepsis, or whatever it is, and keep them in that nursing home, it's really better for the hospitals. And it's better for that person not to have gotten sick in the first place. And if we can figure that piece out, that piece that happens when they're not in the hospital, to keep them from being readmitted or admitted in the first place, it allows hospitals to focus on, either more acute issues, or more, work on being more selective about the types of business they do. Because from a medical surgical standpoint, if you look at where hospitals make money, most hospitals make money in surgeries, and most of those surgeries are elective surgeries. They're choices people make. And I say elective in the sense that some of these are surgeries that people can schedule. They're not emergent surgeries. And this drives, and procedural volume drives, a lot of hospital revenue. Whereas a lot of your inpatient revenue it just doesn't drive a lot of margin, but you have to do it because that's part of why hospitals are there in the first place. If you get sick and you need to spend the night in a hospital, you need to have people taking care of you. You need to have a nurse around the clock. You need to have a hospitalist. You need to have a specialist there. But how do we get to a place where we're not utilizing our resources for that? Because I can tell you, across every hospital, we don't have enough nurses. And in some areas, we just don't have enough doctors. And we're only getting more and more people. People are living longer, they're getting older, they're having more issues. So we have, this year we'll have more people that are over 80 than we've ever had. And next year it'll be more than that. So there will always be some type of business in the hospital.
Yeah.
So I would say that there's not this plan behind the scenes to try to get people, keep people sick and in the hospital. What we really would like to see is people going and seeing their doctors every year, getting a checkup, trying to identify these issues before they come along. Men, depending, on their background, are getting their colonoscopies at 45 or 50 or, whatever is recommended for them. And, I know a lot of people that just don't do that. And I've known several people who get cancer diagnosis that could have had that diagnosis years ahead of time had they just done what they were supposed to do. And
Right.
I think that's where hospitals really want people to take care of themselves. That's where we would like to see you, is in the outpatient arena. And sure, there's margin there, but that's not what it's about. It's about keeping people well and identifying things well in advance. And it's always going to be, we're humans, we break down.
Yeah.
There's always going to be plenty of business.
Yeah.
So that's what I would say to those individuals.
Yeah. I mean, it's a free country and people are welcome to challenge healthcare. And I think I'm a part of the healthcare system in some form or fashion. And at the very least, I'm an advocate for it. And it's not perfect. It never will be. But I think a lot of people fail to see, well, first off, they undermine all of the people really working hard and have a passion for helping patients. There's like this theory of like follow the money, right? What are they incentivized to do? Charlie Munger has a quote, show me the incentive and I'll show you the outcome. And a lot of the incentivization is based around, how can we make money? And so people go, oh, well, if you keep them in perpetual sickness, we'll continue to make money. Right. But at the same time, I really think it's unfair because just a few days ago, you were giving a talk on throughput and you sat there and you told everyone, you made it extremely clear. I think you repeated yourself as you were saying, we want patients to exit the hospital. We want you to get out. Like we want you to get the treatment that you need and then get going. We don't need you here. We don't want you to, not that we don't need you. We don't want you to continue to need treatment here because it's acute care. Right. Yeah. And another thing I'll say is that show, The Pit, great show. It's about the emergency department. They say it's probably the most accurate. And I think it gives people a good idea. It's like the hospital isn't built to help you with your longevity, your wellness, your nutrition plan, although it does make some attempts. But it's there for those who are like, look, I just found out I have stage whatever cancer. I just found, I just broke my ankle. Please put it back together. There's a big difference as to what the intention is.
Yep. I think that's a good way to put it. It is. It's for those, acute right now issues.
Yeah. Yeah. And that's an industry and on its own. And you brought up another good point at the talk where it's like, there's other skilled facilities built for different intentions. And those are the facilities that you need to go to. And I was nodding my head like pretty heavily at that point. I was like, stop blaming all the hospitals.
Yeah, and I think I said in the other day, one of the things I said was, I would tell my own parents, they were patients in my hospital at various times, and mom was a patient probably in my last hospital was a patient maybe a year and a half ago. And what I would tell her is, she's like, oh, this is a great hospital. That's great, Mom. But as soon as you're ready, you need to get out, you need to leave the hospital. And she was like, well, I kind of want to stay here a few extra days or stay here through the weekend. I was like, no, you're good. Yeah, like you're fine. She was in our rehab hospital section the last time. And I knew that we needed beds for other people that were coming out, but at the same time, she had achieved her goals that she needed to, and it was time for her to go home. Mm-hmm. And I remember having this conversation with my sister, and my sister was like, well, it's the weekend. It's going to be hard for me. And I was like, that, it's fine. We have to figure this out together. But the reality is that when it's time for a patient to go home, we need to open up that bed, and we need to make sure that, when there's not anything else we can do for the patient, they kind of need to go, because
Yeah.
here's the not so secret thing about a hospital is that, every week when I would talk to our new orientees coming to start work at the hospital, I would say, for those of you who've never worked at a hospital, you have to realize this is that it's a place where there's, a lot of disease states. There's just a lot of stuff
Yeah.
floating around here. And we talked about the importance of washing hands and, how we can spread disease easily if we're not careful. But for these patients who have compromised immune systems, it's a dangerous place.
You're right.
And we try really, really hard in the hospital industry not to spread something else. I mean, we don't want to give you something that you didn't come to the hospital with. But
Yeah.
every day in American hospitals, it happens. And the longer a patient's there, the more likely it's going to happen. And while the patient needs to be there to have people take care of them, that's great. But as soon as they don't need to be there, it's time to go home. Home can be a safer place. And I know that's a strange thing saying, from a hospital standpoint, but it is the truth. And we need to, people need to go to the right care at the right time. They need to go to a rehab hospital, or they need to go to a nursing facility, or they need to go home and have home care. But that's something that, we all need to be a part of and plan. And we are disjointed in this industry. We try to work together. And that's where I think we could get a lot better. If we can, create a system where people's lives, from when they're in the hospital to when they go back home, or, we have some kind of oversight, even if it's passive, as long as the patients allow it, that, allows us to say, hey, something's going on with your blood pressure. Let's get that checked out before you have an event and you have to actually come to the hospital. Maybe we can address that in an outpatient way. And I think that's where we're headed. I hope it is.
Yeah.
I hope by the time we get that age, I hope that somebody is passively taking care of me. And I don't have to go to the doctor all the time, but they're calling me when something's off.
Right.
And saying, hey, come in and let's check this out.
I've actually never thought of it that way. Like, by the time I'm in a state where it's a little bit harder to move around.
Right.
Hopefully there's some monitors on me or in the house that like indicate, hey, my blood pressure's really low, and someone comes and gets me or reaches out, making sure I'm all right.
That's right.
Yeah. And why wouldn't that be the case? That should be the case. You're absolutely right.
Yeah.
It's funny. I was just speaking with a physician the other day, and he's an orthopedic surgeon, and he was saying, we do need to be careful with all this. There's a balance with all this treatments that you can do at home and staying at home, and then not having it turn into avoiding going to see your doctor, avoiding to see the physician, and relying heavily on, a virtual meeting or something like that, that it's really hard to diagnose someone when you're not there. Like, the technology hasn't gotten to the point where there's like a virtual reality doctor who's able to check on you. So there's pros and cons, and there's balances. And going back to the first thing you said, first thing we spoke about, a lot of change is coming in the next 5 years, and it's going to have a massive impact.
I think so. And I think right now, we have wearables. Most of us wear smartwatches. I mean, there's things that are there, but, I think we've got a ways to go. And I think it's going to go from wearables to implantables. And it's very futuristic and sci-fi, and people feel like Big Brother's taking over, and maybe it is. I mean, and that's part of it anyway, right? We have security systems in our house that passively monitor our house all the time. We don't interact with it. We just, if something happens, it calls the security company or the police or us, but it's there, it's watching, it's listening.
Yeah.
And it's just this next step. Do we want to do this with our own bodies? And I mean, personally, I think it'd be great. I would love to have something planted to where I can go about my life, and I wouldn't have to worry, because I mean, you can talk to any family practice doctor, internal medicine doctor, or urgent care doctor, even ER doctor, and how many people come in to see you every day with an issue they're having that's not really an issue. It's a lot.
Yeah.
I mean, because people like, I have a pain I've never felt before, and they're worried about it, rightfully so, and they come in. But we always say it's better to get it checked out than to not get it checked at all. You're having some chest pain. Is it indigestion, or is it a heart attack? We don't know. And we have to go and use medical care and somebody's time to figure out if that's the issue. But if we didn't, just think about everything else we could do. It would just be, and our anxiety level would hopefully be lower because, I'm having this chest pain, but doesn't seem to be an issue. Nobody's calling me.
Yeah. Yeah.
I'm just going
That's-
to take a couple Tums and lay off the salsa. Yeah.
Too much queso in the dip.
That's right.
But no, you bring up some really good points. Privacy, Big Brother, and all that. And yeah, sure, I definitely want my privacy. But my parents live a 10-hour drive away from me, and they're in their 70s. And I, having been an orthopedic trauma rep, I just fear the day that I might get a call and somebody just slipped and fell trying to get in or out of the shower.
Mm-hmm.
And then, so if there's, and then they can't get to the phone. Remember that commercial where they're wearing that wearable?
I'm falling and I can't get up.
Yeah.
Yeah. We used to laugh about it. Now we want one.
Right. Yeah. So I'm not doing anything illegal. My parents aren't, I don't think. So let Big Brother watch as long as they're safe,
That's right.
But, just to change gears a little bit, there was something you brought up the other day I wanted to ask you about. Physician executives. So there seems to be an increase in the amount of physicians, clinicians who are moving into healthcare administration in the C-suite. Why? How? What's the impact?
I think there are a variety of reasons. I think, the one that always floats to the top is physician burnout. I think it is extraordinarily hard to be a physician. If you're a primary care physician, you're paid by the number of patients you're able to see per day. And really why a lot of those physicians got into business in the first place is to develop relationships and talk to their patients. And they just don't have the time to do that because they have so many patients to see. And I think for them, it feels like they're working in a factory sometimes, and it gets monotonous and it'll burn them out. I think on the other end of the spectrum, your surgeons, it's not easy either. People are on call at night and weekends and having to, what we used to call holding the pager, and now they're just holding their phone. But it is your entire life is, goes from what you thought was going to be, 40, 60 hour work week to, over 100 hours because you're getting called in at 2:00 in the morning to come, address a broken hip or, whatever it is. And your life becomes, something it's difficult to control. And you do that for years and years and years. And it's hard. And I think especially some of the younger physicians coming through have had this opportunity to get involved as medical directors, and they get drawn into the idea, I can do something for the healthcare system beyond just what I was trained to do. And so you see surgeons and you see internists that are more and more getting involved, and usually they, are medical directors, and then they'll eventually become a chief medical officer. They already understand how to work with the key customers, which are not just the patients but other physicians, and they have the ability to grow a business and improve quality. So they bring a unique set of skills, and it is interesting. I do see more and more physicians getting involved in administration. Now, here's the one thing that I think a lot of young physicians may not realize is that just because you get into administration, it doesn't necessarily decrease the time you're going to spend working. In some ways it increases it, and your life becomes not just your practice, but everybody else's practice as well. And it can be a difficult transition. It's not the greener grass. It's just different grass.
Okay.
But I do see many physicians wanting to do this. I see a lot of them want to do it kind of they don't quite understand what it is, and they may not stick with it. But the ones that are doing it for the right reasons, or they've become great administrators, and people I've enjoyed working with.
Yeah. I've seen a lot of former nurses or make their way to chief nursing officer, and some have then moved to COO, CEO, and moved up. And it's sort of I having been on the vendor side my entire career, I attribute it to the salesperson who then went into corporate and was valued for his or her ability to understand what's really going on in the field.
Right.
And and at a certain point, you're then challenged, can you handle the leadership of a large organization? And if they can, it's a wonderful thing for that organization to be able to have someone who's I was customer facing for X amount of years.
Yeah.
But at the same time, I would imagine there's certain amounts of education that needs to take place, some sort of training in order to be able to truly understand a P&L and what it is what does it mean to be a leader and manage managers, et cetera. That shouldn't be unaccounted for. But to your point, with the more physicians moving in that direction, I would imagine maybe a not so noble reason for trying to do it is to forward your physician practice or to get your segment of the business more focus and more attention, which actually isn't a bad thing. It's just through their lens, right?
Right.
Would that be the negative behind it? I don't know.
I don't know. I mean, I think I've seen a lot of physicians go back and get their MBA.
Mm-hmm.
Well, it's interesting, like, especially during COVID when things slowed for a little while, you saw this high number of several of our physicians, all of a sudden they had enrolled in either Georgia Tech or Georgia's MBA executive programs. And then I've seen a lot do that since. And MBA programs love taking doctors in. It brings a unique perspective to that class. Doctors enjoy, I mean, it's a different skill set. And I think whether they use it, to create a career in healthcare administration or just, to build a better practice, I think either way, it's great to have those business skills. That's always been something we've talked about for years, is that you will see some physicians and they're very good at what they do from a clinical standpoint, but it would be difficult to have these conversations on, what is your true margin? I mean, here are your expenses. Some of them still don't quite understand that. And you have to have those discussions like, like if you own this practice, would you actually have 3 nurses working for you, or would it be 2? It's something I think, be great in medical schools if they taught just some level of business.
Yeah.
But I think, it's important, and it's a different language, but it is important for physicians to be able to understand that and speak that language and be able to look at a P&L statement or a balance sheet and glean information from that and have, educated conversations around it. Just the same way it is for, hospital administrators that came up the business side. They need to understand the quality measures. They need to understand the disease states. They need to understand different types of surgery so that they can, work with the physicians to make the right selections on equipment. So I think we all need to learn a little bit more about the other.
Yeah, no, you're absolutely right. And would love physicians to have the ability to learn more. I mean, they're overloaded with understanding, what they need to know to be able to treat patients, which arguably it's like you could do multiple lifetimes of that. But
yes.
No, I've had multiple management service organization individuals who started companies to help manage surgeon practices and help them be able to run the business side of things while they handle the patients. But in addition to that, I remember I was not even 2 years in, and it dawned on me and my senior sales rep, who was my mentor. He said, look, if you ever want to get a room full of physicians, just put on some sort of a dinner with a projector and just say that we're going to help educate you on the business side of things. Yeah. And the physicians come running, right? They want to absorb all that information that anyone can provide them to help them be better businessmen, to be able to run a better practice or all these other things. If you're going to tell them, hey, I got this new widget, come on down, flip a coin whether they're able to show up. But if it's all about providing value, and the number one piece of value that we could provide, especially the residents coming out in training, coming out, looking to better understand the business side of things. Should I be an employed physician? Should I join a practice? And what are good terms to be able to say this offering from this practice is a good idea? They don't get enough of that. So to all the vendors out there, if you're looking to help some physicians and get in front of them, put one of those together and they'll come running, I promise.
I agree. I think it's very valuable.
and you moved over to what I believe is the real estate side of things. Can you talk to me more about that? Is that a passion? Because I know that there's big business in healthcare real estate,
Yeah,
commercial real
that's
estate.
right.
Can you help
Yeah.
educate me on that and what went behind that decision and what's going on in that world?
Sure. Yeah. I mean, I had an opportunity a little less than a year ago to kind of take a little bit of time off
Yeah.
from from being a healthcare executive. And again, I've done this for over 25 years, and just wanted to step away a little bit, take a little time with the family, and see kind of what else I could do for a year or so. I've got a friend that I had worked with. He was a colleague that has been in healthcare real estate for many years, and he's done a lot of work for us. And when I started out early, one of my first jobs was overseeing real estate at Brookwood Medical Center in Birmingham, and it it's a very big piece of healthcare systems expense. We have to lease a lot of space. We have to do a lot of build out. Running these clinics is expensive, and making those decisions has always been important to me. And then choosing the right location, making sure the build out was correct.
Yeah.
You don't want to pay for a lot of square footage that you're not using. So how things are built out is very important. And so it was kind of an interesting and easy transition. I had the opportunity to join him about 6 months ago, and it's been fun. I've been had the ability to work with some other large health systems. Most of these people are people like me that I've known throughout the years that are at health systems across the U.S. that also have real estate needs, and they really what they need is just the ability, one for someone to manage their portfolios and help them determine where they can reduce expense, negotiate better agreements, make decisions on when they need to purchase a piece of property versus sign a long term lease. And I've learned a lot about the industry that I probably didn't completely understand
Yeah.
before. And especially what motivates the people that own these buildings. A lot of these buildings are investments by large companies, and their concessions that they make, usually in either rent abatement or what they call tenant improvement, where they put money toward a build out, are usually grounded in how long they can get somebody into a lease, because it's all financial. It's very it is an industry where, from the investor side, there's not a lot of emotion. It either makes financial sense or it doesn't.
Yeah.
And from those people leasing, sometimes need to be careful, because it can be very emotional. Is this a nice office for me? Do I have a window? But at the end of the day, does that matter? I mean, what matters is your patients. They can find the space easily. It's easy for them to navigate. It's nice. They can park close by.
Yeah.
So all these things are, it just gives me a different perspective. And I think whether, I stay with this or re-enter the healthcare executive industry in the near future, this has been a great experience. It's given me the opportunity to touch a lot of different systems, and both executives and physicians, and work on something that's, always been a piece of what I've done in healthcare.
Right. Yeah, no, that's awesome, because you have so much experience in the executive space for you to be able to get out beyond your office or the building that you oversee and the people that you oversee, but to be able to, I can only imagine you touching all these different spaces in the territory, will only lead you to understand so much more, appreciate so much more, and whatever choice you make next, you're going to be that much more valuable to whatever organization it is. So I'm excited to see where it goes for you, and I'm very, very grateful to have had you on. And would love to have you on again, maybe have a deeper discussion about the
Indeed.
commercial real estate side of things. But if there's one last thing that you had to say to maybe those who are in healthcare administration and hoping to hopefully have a career like yours, that spans so many large, notable organizations and leading these businesses. What advice do you have to give to these young future leaders?
Yeah, the advice that I've always given to young leaders is spread your net wide. There's a lot of opportunity out there. And sometimes that opportunity may not be, in the middle of Atlanta. It may not be where there's a lot of other young single people. And that's okay. But there are lots of opportunities. Just say yes. You get a chance to see many different parts of the country, some that you may love living in, some that you may not, but they all need great healthcare leaders. And it gives everyone an opportunity to advance. So, ultimately, keep your options open, be okay with moving, and just look for those great opportunities, because people love to see people that are able to go out and gain that experience. That's important to hiring managers. We look for that. And, ultimately it's a tough industry. You really have to want to do it. And you got to make that decision early. But if it's something you want to get involved in, make sure you're doing it for the right reasons, and it can be very rewarding.
Love that. Love that. The more you say yes, the more opportunities come your way. Well, thank you, Mr. Jon-Paul Croom. We have to do this again, but this was just as good as I thought it would be.
Excellent. Okay. Well, I enjoyed my time with you this morning, and I look forward to being invited back again. Hopefully I get more than one or two thumbs ups, and I'll get invited back.
You're going viral. We're going viral.
Okay.
I love it. All right. Well, thank you.
Thank you as well, and have a wonderful morning.
You too.
Thanks for watching. Don't forget to click subscribe so you don't miss an episode. And remember, if you or a friend want a job in medical sales, the best place to go is medsalesblueprint.com.